Hi guys. So, really. So I thought I would make a video, an update video, as usual. This is in regards to my health. I've gotten a few questions um, for an update, or I guess a few requests for an update, and I'm going to also include, like, I guess my weight loss in this as well. So I'm going to start at the beginning, and my apologies if this isn't interesting to you. God, I'm out of breath. Sorry. So here goes. So it all started 4/19 of 2012. I had been training to run a well, okay. I'm going to go back a little bit further before that. So well, no, I'll just go back. Okay. So 4/19 of 2012, I had been training to run a 5K, I'm sorry, and I was at the point where I could just about do the entire 5K without stopping. So I had gone for a run. It's about, I don't know, 5, 6 in the evening-ish. And when I came home, I noticed I was shaky. And I just, chalked it up to I was running and I had low blood sugar. I'm not a diabetic or hypoglycemic or anything like that. So, but when you run, your body's under stress and being overweight, I just assumed it was that. And the person I live with, or lived with at the time, she owns this house and she's an RN, so, she told me to eat. So I did, and it just kept getting worse. Go get your toy. Go get your toys. Yeah, so I made myself something to eat, and it just would not go away, and it just progressed, and pretty soon it was like my legs, my arms, my neck, and I couldn't stop. And my God, it was like a month of just shaking. And if you've ever seen anybody with Parkinson's disease, then that's what I looked like. Of course, I saw my doctor. First, I saw the NP, and it was a nurse practitioner I'd never seen before, and she was super nice, and she told me, she's like, I'm trying to listen to your heart, and all I can hear are these shakes. You're very helpful. She's like, all I can hear is your body shaking. So she told me that she was worried that I had tetany, and I knew that I didn't have tetany because that presents with like muscle rigidity. I didn't have that, but she had tetany, and I think that's why she thought I had tetany, because she was kind of paranoid about tetany. But anyway, so she told me to go to a hospital that was outside of our area, and I didn't go. So she called the doctor, who is my primary care doctor, and that doctor agreed with me, but she told me to go to that ER anyway, and I didn't go, but because I'm non-compliant. But I don't know, I just didn't know what to do with myself, and it was like I couldn't stop shaking, and I'm trying to work, and my job involves a lot of writing, and I couldn't write legibly, and it was very frustrating, so I just sat at my job and shook. And so my insurance wouldn't approve an MRI, and I'm like, I'm an otherwise healthy person who can't stop shaking, really? And then they sent me to cardio, and I don't know. So anyway, so finally I got the MRI, and it came back normal. I saw a neurologist, and he said he didn't even look at me. He didn't take any vital signs. He said, there's nothing wrong with you. Go back to work. He said, you have anxiety. I said, I don't have anxiety, but can you at least examine me? And he did nothing. So I walked back to work. I went to the emergency room, just where I work at a hospital. So I went downstairs to the emergency room a couple days later. I said, can you please give me something so I can stop shaking? And they said, well, you have anxiety. And I said, how can I have anxiety when I'm sitting here in a chair with a heart rate of 75? I'm not nervous. But I said, fine, give me something for anxiety so I can stop shaking. They did. Nothing happened. Except for that I learned that I cannot have Ativan because it makes me cry. So, good to know, right? So then I went home, and then I couldn't stop shaking. Well, I don't know. I went over to the cardiologist, and they put on a monitor and showed nothing. Okay, well, very frustrating. They took the monitor off. The next day, I rode my bike, and I fainted. And I had an unusually high heart rate, and I could feel it. So I told my doctor, well actually I told another NP who I've seen for probably a year, I said, I'm fainting because my heart rate's so high. And she said, that's not a normal thing, but we will refer you to a cardiologist. I said, okay. So I'm waiting for my cardiology referral. Well, I'm at work and I couldn't stop shaking and I was so dizzy and I'm having this high heart rate, and I work as a telemetry technician, so I hooked myself up to tele. Well, then I'm noticing that I'm having these periods where my heart rate is just, it was out of control and it's dipping, and I'm like, oh, what is wrong with me, right? So I went down to the ER again and I said, please give me something to stop shaking. I can't take Ativan, it makes me cry. Well, they gave me Ativan. I sat in the ER and I cried. I mean, I don't feel any pain, I didn't feel anything. I just said that. I was like, oh, and they're like, are you in pain? No. Are you sad? No. I looked stupid. Okay, good to know, right? So they sent me home and probably thought I was a nut, but that's okay. So I go back to the cardiologist and I told them, my heart rate is very high. Well, they increased my beta blocker, which I took for migraines, and that was that. I got a referral to another neurologist. The neurologist gave me Topamax, and that is an anti-seizure drug, and he did an EEG, which they hook you up to all the electrodes and make you look real sexy. And I don't have seizures, but he gave me this drug, Topamax, and lo and behold, I stopped shaking, and I could be a relatively normal person. And he told me that I have an essential tremor, which I know basically is kind of a cop-out, but he said it's made worse by stress, and it's probably made worse by cardiac stress. Okay, so when they can't find something wrong with you neurologically, they're going to blame it on something else. Okay, so there's nothing wrong with me neurologically except for that I have a tremor. No big deal, but I'll be damned if the Topamax didn't stop the tremor. So, I mean, you can see it here and here. I mean, look at my hand. It's just, I can live with this. I can be a normal person. I can write. I don't care about shaky hands. I'll never be a surgeon. Who cares? And actually, when I went to the cardiologist again for a follow-up, he said the propranolol would help with the tremor. Cool. Well, I still am telling this doctor that I can't do anything because my heart rate gets so high. I can't run. I was trying to do a 5K, but I can't run because my heart rate gets so high. And it was actually measured at 210 beats a minute, and that's not a normal heart rate, regardless of what you're doing, right? So I'm trying to tell them, like, I faint. My heart rate gets so high that I faint. Well, finally, they decide, oh, we're going to do a stress test. Well, I go to do my stress test, and I fainted. I didn't completely lose consciousness, but I got so dizzy that I fell on the ground in front of the doctor. Good. Not good that I fainted and fell, but like good that they saw. I look like an idiot, but good that they saw me, fall on the ground, because then they know, oh, she's not stupid and crazy. So, there. Okay, so they upped the beta blocker again. Well, I don't know. I went to work and I started feeling really, really dizzy and sick a few days later, and I put myself on the monitor at work. Oh, my heart rate's 30. Not 30. It was like 38. And I'm like, okay. So, I printed out some strips and I brought them. Well, they took away the beta blocker because that's too low. So then that left me with a totally uncontrolled heart rate. So I'm having heart rates of like 38 and 185. That's a huge difference. Well, no wonder my body's trying to compensate by fainting. Okay, so the head of this cardiology group I'm seeing sends me to an EP guy because they're worried that I have this condition that my mom had called Wolff-Parkinson's-White, which is basically you have an extra electrical pathway in your heart. So I had to go see the electrophysiology guy, and he tells me, okay, until then we're going to give you another cardiac med. Okay, so I'm taking this other cardiac med, and whatever, I'm still having this high heart rate, fainting, blah blah blah. I think I was in the hospital twice because of a high heart rate. They didn't really do anything. They just, every time I go to the hospital, still, they give me potassium because my potassium is low. Nobody knows why, it's just a thing. So, finally, my insurance, after fighting with my insurance for about a month, they approved this procedure called an electrophysiology study, an EP study. So actually this guy that I was seeing was brought to our hospital to start our electrophysiology program. And so I'm scheduled to do my test. Well, they canceled my test because, I don't know why. I guess because I was going to be one of the first patients to have this test at my hospital, so they had to have these people there. And so, yeah. Anyway, so finally the test was scheduled and I went, and it showed nothing except for that my tachycardia was coming from my sinus node, and there's nothing they can do about it. So, yeah, basically what that meant is that they couldn't ablate it, and I didn't have what my mom had. And I mean, it's good and bad. It was good in the fact that it wasn't like a serious problem, and like I mean, you don't have to deaden part of my heart or whatever, but like it was bad in that there's really nothing they could do about it, you know? And so, yeah, I had this procedure, and they go in through your groin area, and they put electrodes inside of your heart, and they stimulate your heart electrically to beat in all these different rhythms and try to induce your heart into tachycardia. And I asked to be as awake as possible because I wanted to see, and it was pretty cool because my job is looking at the heart. And so, while I was laying on the table, they're asking me, what kind of rhythm is this? Can you feel that? I mean, it felt really cool. And I'm shocked that we have these patients that come in and they're in these rhythms and they can't feel it, because I was only in the rhythms for less than a minute each time. And I was short of breath, and I'm like, okay. And they're like, we're going to make your heart beat really fast. So I'm like, okay. And I was like, I mean, that's amazing. And it felt pretty damn cool. So, I don't know, it was neat. So I was the fourth person at our hospital to ever have this procedure done, and so whatever thing they're doing, like, that's pretty cool that I could help them start that or whatever. And yeah, so I mean, I don't know, whatever. So after this procedure, my insurance told me that I could no longer see this doctor, which now, looking back, not even looking back, but which now I'm grateful for, because I ended up being in the hospital again because I had tachycardia. You know what, okay. Let me go back again. I had to have my gallbladder out because I had gallstones. Actually, I had one giant gallstone, and I couldn't eat food for 12 days because I was vomiting. And no matter what I ate, I just barfed it up. So I had to have my gallbladder out. Well, while I was there, it was an awful experience at my hospital where I work, and they treated me like garbage. Not on the floor where I work, thank God. But anyway, yeah. So I didn't get pain meds for the entire night I was there, which is the whole reason they kept me, because during the surgery, I guess my gallbladder was full of bile, so it spilled, and they said it was some pain management issue, so that's why they kept me overnight. And I was supposed to go up to the telemetry beds because I have a heart problem, but they didn't have any, so I had to stay on a different floor. So I didn't see a nurse the entire night I was there. Nobody took vital signs, nobody gave me pain meds. It was awful. So the next morning when the nurse came, I was just miserable in pain, and it was awful. So I hope nobody ever has to experience that. Anyway, so I ended up acquiring an infection, and I didn't know it. So I went to the hospital for tachycardia, and while I was there, the doctor that did my EP study told everybody at the nurses station, at my job, on my floor, that I was non-compliant, and that's why I was in the hospital. Well, it turned out that I had an infection, and I didn't take my meds. That's why I was there. So while I was there, they found out that I had an infection, which was causing me to have diarrhea. And, I knew I had diarrhea, well, duh. I just assumed it was from having my gallbladder out. So, yeah, basically, I was crapping out all of my medication, which is really lovely, I'm sorry, but, it's the truth. And that's why I didn't have any control over my cardiac meds. And, I had told my primary care doctor, I've been shitting since I had my gallbladder out, and she said, well, it takes a while for your body to normalize, which I had read, and, whatever. It is what it is, and she discovered I had this infection, so they gave me meds, and it went away for a while until I discharged, and then nobody gave me medication, and it came back, and yeah, then I had medication, and it went away for about a month, came back, then I got some medication, a different kind of medication, and then it went away, and now it's back again. So it's just a long and stupid, frustrating process, and that's besides the point. So yeah, anyway, back to my heart thing. I'm very frustrated, can you tell? I just hate my insurance company. They're awful. I hope nobody has to ever deal with them. So anyway, I'm grateful that I never have to see this cardiologist again. So I was referred, so now that I don't have to see this cardiologist, I see a different cardiologist in the same group. And it's very lucky for me because he comes to the hospital where I work every day. So basically I can see this guy and he's interesting. He's very nice and he has this interesting hair and looks like Mick Jagger. You're filthy. And he takes me seriously, and I mean, yeah, so we had talked about a procedure called a ganglionectomy, and what they do is they snip your sympathetic nervous system and it makes you unable to be tachycardic, and eventually it grows back, and the hope is that I'm young and eventually I'll grow out of this tachycardia. Okay, so they referred me to USC, and I saw a surgeon, and she's their chief of cardiology at USC, and she is wonderful. Well, she refused to do the procedure, explained to me that it probably wouldn't work. Okay, so she prescribed Wellbutrin. Well, the reason she prescribed Wellbutrin was in the hopes that it would promote serotonin in my brain and calm down my nervous system, and she diagnosed me with dysautonomia, which is a dysfunction of the nervous system, and in my case presents with inappropriate sinus tachycardia. Okay, so for 3 months I took Wellbutrin along with the drug to lower my blood pressure, which was aldactone, and it didn't help. So, you know, I'm out of breath from talking so much and from being angry. I'm sorry, I'm just rambling. And so I was telling her it wasn't working, so she put on a patch, a Zeo patch. I'm going to try to include pictures because I have pictures of all these things. Me with my lovely EEG, me in the hospital, me with my lovely patch. So she put on this patch, and it showed bouts of, there was some bradycardia, but it was mostly tachycardia and then normal. And it showed that I had a junctional rhythm, which is basically your heart beats from the sinus node, and if the sinus node fails, it will beat from the AV node, and if the AV node fails, it will beat from the ventricles. So junctional comes near the AV node, and it's a fail-safe. And usually athletes have that, and they don't treat that, but I'm not an athlete, so you know, it's a bradycardic rhythm unless it's accelerated, blah blah blah. It's too much information, but I'm having these junctional rhythms, and that's not supposed to happen. So that happened. She wasn't all that concerned the first time when she put it on, and so, you know, we kept going with the treatment, and she raised the dosage. So a couple months later, I emailed her and told her, you know, I'm junctional and I'm not feeling well, and my blood pressure is dropping, and I just feel awful. And so she ordered another patch, and I put it on, and there was a day at work I just felt terrible, and so I put myself on telly at work so I could look at myself, and my heart rate was like 40, and I could feel myself just, God, I felt terrible. I mean, that's the only way I can explain it. I felt lightheaded, and it was almost nauseated, and it was like bad. And I had, a couple days before she put the patch on, I thought I had a heart attack. Like, in all seriousness, I was laying in my bed and I just felt sick, and I was watching 30 Rock, and all of a sudden I just had this huge amount of chest pain, and it was like an elephant was on my chest, like a vice was gripping my heart, and I don't know, all of my vision just blacked out except for 2 pinpricks, and I vomited, and it was like I was so dizzy, and my heart rate was in the 30s, and I took my blood pressure, and it was 70/30, and a normal blood pressure is 120/70. I mean, it was awful. I almost called 911, but then I realized that they would take me to my job where I work, and they wouldn't do anything, which is an awful thing to say about the place where you work, but I'm going to be honest. And I mean, I really literally thought, like, I legitimately thought I was having a heart attack. And so I called my cardiologist, and the one that I see in Hemet, here where I live, and he told me that it was probably because I was bradycardic and my heart wasn't having enough oxygen, which makes sense, you know, that I was having so much chest pain. And so I didn't call 911. I did go to my job and put the telebox on, and I was in a junctional rhythm. So that's why I emailed the lady at USD. Okay, so that's why she actually put the patch on there. So the day at work that I felt so awful, I was in this junctional rhythm, and it was awful. So I had plans to go to Vegas. This was a Thursday. My friend was coming in from New Zealand, and we were all gonna go to Vegas to see Fleetwood Mac play, and for the weekend. And it was like, am I supposed to go on my trip or not? I don't want to not go, but it's like I feel terrible. So I don't know. And I mean, I was having another friend who works at my job and is also a teletech go, and I had spoken with some nurses, and I was like, well, I'm gonna go, and if I feel any worse, then I'll come back. I'm wearing this patch. I can always email my cardiologist and tell her, like, pull up my strip now. I'm feeling terrible, but I'm gonna go because I want to see Fleetwood Mac. So I went, and the Friday before, we were leaving on Friday, and the Friday before, it was awful. I was so dizzy, and I couldn't drive, and I had somebody else, the girl that worked at my job, she drove, and I was like, just in case, here's the number for everybody, I mean, I felt awful. It was that bad, but I wanted to go. And then I swelled. I weighed myself the Thursday, before we left. I weighed 183, and Saturday night, I weighed 200 pounds. And I'm not exaggerating. I couldn't wear clothes. I couldn't wear my pants. I couldn't put on my shoes. I looked like Mickey Mouse. My feet were swollen. My hands were swollen. I looked awful. And a lady in the casino where we stayed at Paris, I was walking from the door of the casino up to our room. She stopped me. She said, "Why are you wearing that blue patch on your chest?" And I said, "It's a heart monitor." She said, "Well, I know that. I'm a nurse." And I said, "Well," she said, "Are you in heart failure?" And I said, "No, it's actually for tachycardia." And she said, "You're in heart failure. You need to go. You're in congestive heart failure. You're swollen. Your face is swollen. Look at your feet." And I said, "I am aware. I work in I'm a teletech. I'm going to nursing school, whatever." And she said, "You need to go. You need to go to the hospital. You're in heart failure." So, yeah, it kind of scared me. And it was like, yeah, something to joke around. I'm not laughing, so it's like, haha, I'm in heart failure. But it was like, oh, I couldn't even bend my fingers. I mean, my fingers are already big, but I mean, it was like this. My fingers were like this, and it was scary to me. I looked like Mickey Mouse. It was awful. And I emailed the cardiologist that I am seeing at USC, and I told her, and she emailed me right back. She said, obviously put your feet up. And before I left, just so you know, I had gone to my doctor, and I told them I started to swell, and I said, I need to have this test ran to check for heart failure. And they never called me with the lab results. And I went and had my labs drawn and whatever. And then that I went to my concert, came home. The swelling started to go away. My heart rate went back up to normal, and it was, the whole time we were in Vegas, it was really low. It did start going up to normal, like the last couple days we were there. I got a tattoo while I was in Vegas, so I mean, I don't know. I don't want to like trivialize anything, but it was like, I don't want to like not live my life. I'm not an old person. Not like old people can't live lives, but like I'm not old. This is the time of my life I should be enjoying, and I've had these plans for like months, and it's like, I don't know, and nobody here seemed to take me seriously. So it's like, well, I guess I'm not dying. Do you know what I mean? It's like, okay. So I came home. I called my doctor, the cardiologist I see here in Hemet, and I made an appointment. Well, the appointment was canceled, and because he hurt himself. So I went and saw the nurse practitioner that I've been seeing for a couple years, and she told me, "Well, you're not swollen now." And she wouldn't listen to me, so I got really angry at her. And then I found out my doctor had ran the wrong lab test, so it did no good to have my labs drawn. And I left, and I was very angry, and I said, "Well, thank you for not listening to me." And I made an appointment to see my cardiologist here in Hemet, and I told him what had happened, and he was concerned, and as he should be, he's a cardiologist, and he ordered the right lab test, and I don't even know what to say. It was like, finally, so, but nothing ever came of it, and it was like, if I I feel like they think I'm crazy, or they thought I was crazy. Not my actual doctor, but it's like I'm not a crazy person, and I'm not a hypochondriac. I mean, I actually went and got cleared. I do see a therapist because, you know, I have depression, and I went, everybody kept telling me I had anxiety. Well, I went and got cleared by my psychologist, who I've been seeing for almost 2 years now, for anxiety, and just in case they thought I was a hypochondriac. So I went and got cleared by psych, and it's like no matter what I did, oh, you have this, oh, you're anxious, oh, it's this. Well, I mean, what more do they want? So it's like I went to my doctor, and he took me seriously. It wasn't like he was like dismissing me, but it's like, so nothing ever came of it. Well, finally, we were talking about this procedure called the sinus node modification, which had been brought up about a year ago, and the first doctor that did my EP study had agreed to do it. Well, then nothing ever came of it. Well, I'd asked my cardiologist if he would ask that doctor to do it, and that doctor said no, because I was too young. Okay, so, because it might lead to a pacemaker placement. Well, I realized that, and I was willing to take that risk because I can't be like this anymore. I can't go for a walk. I can't do yoga. I can't ride my bike because I faint. And I was brushing my teeth, and my heart rate went into the 160s. It's like I can't even brush my teeth. That's not a normal thing. I can't walk 300 feet without being out of breath. And I don't get it. I don't get why people don't want to help me. I want to help all of my patients, and I don't see why, if I was 80, they would do the procedure. I'm 28, they won't. So there's a lady at my work that had this procedure done twice, and she's maybe 40, and she lives this full life. She says my heart rate never gets above 140. I can go for a run. I'm good. So I had an appointment to see my cardiologist at USC, and I was going to bring up this procedure with her because she does them, and that was that. Well, I had spoken with my cardiologist again here at Hemet. I don't know, so many cardiologists, and he talked about this drug that's only available in Europe. It's called Avabradine, and you can't get it in the US because it's not available yet. Hi, Liv. And excuse you can get it in Canada if you have a doctor's prescription. So that was going to be our next plan. And looking at the side effects online, I've actually read, the official studies. There's not many side effects. There's not many drug reactions. So that was going to be what we were going to do. Was I was going to get a prescription from him and order the drug from Canada and try it out. I've taken so many pills. I've taken 3 different beta blockers. I've taken 2 calcium channel blockers. I've taken this Wellbutrin. I mean, the one that had helped the most, I guess, was a drug called verapamil. But I was taking way over the prescribed dose, and when I went to see the cardiologist at USC, she was not a fan of that. So anyway, so my appointment with the cardiologist from USC was yesterday, and so walking from my car to her office, which isn't very far, my heart rate shot up. And so, they did the 12 lead EKG, and it just showed sinus tachycardia like always. And she said, I mean, I'm not happy that my heart rate was high, but it's like, good, I'm glad they can see this because this isn't a normal thing. I'm not an old person. I'm not a drug user. I've never done these things. I'm not a diet pill user. And it's like, this is not normal, So she saw it, and she said, well, obviously the Wellbutrin is not helping. So, and I wanted to ask her if I could stop taking it or wean myself off of it anyway, because it's causing me tons of forgetfulness. I feel like I have Alzheimer's disease or something. But so anyway, so she said, I want you to wean yourself off of it. Well, so she knew, and so yeah. So she said, well, Natalie, this is what I want to do. I want to put in a pacemaker. All right. I used up an entire memory card, so I'm not sure where exactly it cut off. So anyway, so she says, I think this is about where I ended up getting cut off. But so I'm a cardiologist, and she says, I want to put in a pacemaker. What are your thoughts? Thank you for that. And I said, why? So she says, well, Natalie, we've done everything else. We've done meds, we've done these calcium channel blockers, we've done beta blockers, we've done natural things like with breathing exercises, we've done... Alright, so I talked so much that I used up both the memory card and the battery. So I think the last thing I'd said was I went to my appointment yesterday and we had been discussing my last Zeopatch, the second Zeopatch results, and she told me that she wanted to put in a pacemaker, and the reasons why were that she didn't feel comfortable giving me any more medications because of the bradycardia, the slow rate, and which is the slow rate, and the junctional rhythm, and how I was symptomatic. So where it stands now is that I'm awaiting insurance approval, and I will be getting a dual chambered pacemaker. So that's that. Yeah, I mean, I guess that's kind of a big thing. I don't know. I do still kind of want to ask her about the sinus node modification. That is something that she could do while she's putting in the pacemaker, or perhaps I don't know. Yeah. So, I know that that's just a hair in my eyelash. I know that while they're putting in pacemakers, you're generally not put under. It's the same thing they do while you're having your EP study. I'm going to speak with her about being as awake as possible during the procedure. I'm not nervous about the procedure. I'm not nervous about having a pacemaker in general. It's more of like, I guess, I don't know, it's not even the point of having a pacemaker. It's like something in my body, I guess. I had spoken with my doctor here locally in Hemet about a pacemaker about a year ago. He said nobody would do it because I'm young, and he wouldn't do it because I'm young. But here's this cardiologist at USC who said it's, she's like, oh, let's put in a pacemaker. She's like, I don't want to do it, you're young, but it's kind of, we've done everything else. And so she's obviously a well-respected person. She's the chief of cardiology at a major hospital, school. She's hugely respected in her community, and I respect her a lot. The first thing I told her was that her name is Dr. Saxon. I said, Dr. Saxon, she actually trained the cardiologist that I was seeing, the one that told me it was, the one that had said such things at my job. I said, I've been told I'm crazy. I've been told that it's all in my head, that, yeah, you might have this problem, but it's not a big deal. And she said, you're not crazy. There's nothing in your head. A lot of my patients come here, and especially women, they're so dismissed. And I'm sorry that you're going through that. I will not do that to you. And she hasn't. And everything I've told her, she's taken seriously. And she has told me, you're a smart person, and you know your body. And, on this little Zeopatch, I'm going to put a picture in. On this little Zeopatch, there's a little button that you push every time you feel something. And the first time I wore it, I pushed the button, I think, 9 times. And every time I pushed the button, it corresponded to an event that had actually happened. I pushed a button, I was having a high heart rate. I pushed a button, I was having bigeminal PVCs. I pushed the button, I was having, events. The only time I pushed the button, the second time I had the patch on, I converted rhythms, heart rhythms. So it's not, I'm not psychotic, And so for somebody to finally, I've been seeing her now for 3 months, let's say 13 weeks, 14 weeks, whatever. So like 4 months. Oh, I have slender in my finger. That's nice. So 4-ish, 3.5 months-ish. So for somebody to finally take me seriously after more than a year, it's like this gigantic weight comes off my shoulders. And yes, I'm anxious and I take this procedure, seriously, but it's like I am so hopeful that like I will finally have some peace and I will be able to get on with my life. And like she said, Natalie, the deciding factor for me was, you can't exercise, and I get such a release from exercise. And, not that me personally, I enjoy exercising, but it's not like, oh, I'm such a health nut, but it's like I can't do it. I try to exercise and I faint, or I get so out of breath that I mean, seriously, I try to vacuum my floor and I have to stop and take a break, and that's not normal, So I've lost. Yesterday, she told me, you've lost all this weight. You've kept it off. You've done all these things, but you can't finish what you've started, and that's important. So, that was kind of it, and I agree with her. And it's like I just want to be better, and it's so frustrating that I can't. And when you can't do something, you want it even more, and it's like, So, yeah. So that's that. That's where I'm at in my health, and that's kind of, I don't want to say like that's why I haven't made videos, because I never, I'm always lazy and never make videos, but it's like, who wants to make videos when you feel like shit all the time? And it's like, what do I care about makeup when it's like, my heart doesn't beat right? But it's like, I really don't. And, I do fix myself. I'm not laying in my bed like, oh, woe is me. But it's like, oh, I got a new lipstick. So I don't really have a lot of joy in shopping, because I really don't. It's like I go shopping, I have to sit on a bench. So, yeah. So, on a more personal note, sorry, it's very distracting. Like with my family, in regards to my family, I think I've mentioned on here before that I don't have a very close relationship with my family. It's kind of a difficult one. My dad died, all that stuff. My mom and I, I talk so much, are not close. There is a nurse at my job, Sandy, who I'm very fortunate, since they've taken my license away, and hopefully this week, the deal is that I've it had to have been 6 months without fainting, and I get my license back. So hopefully this week, it's been 6 months, I'm seeing the cardiologist. The one here in town, is going to clear me. Then I take that over to the nurse practitioner who originally took away my license, and she's going to clear me, and blah, blah. So anyway, but since I haven't had a license, this nurse at my job, Sandy, has been driving me around everywhere, and so she's the one that's going to drive me to my procedure to get my pacemaker. And I just am so thankful that I have this person that will take me places. And it's like, it's interesting to have to depend on somebody so much. She's the one that took me to have my EP study. She picked me up for my gallbladder surgery, and it's like I've really had to depend a lot on people, and I feel like it's such a burden. And it will be nice to I don't want to say like gain my independence, but it's like, yeah, it almost is like gain my independence again, because it's like I have had to. Can somebody give me a ride here? And I'm going to be honest and say that I have driven without my license, but it's nerve-wracking when a cop pulls up next to you. You're like, But off topic. So, yeah, I'm just very thankful for the people that I can depend on in my life, and it's like you really do get to know who your true friends are, and these people have really become like family. So, yeah, that really is all that's going on with my health now that I've made this like 17-hour video. And so in regards to my weight loss, I've lost, well, I had lost 99 pounds. I've gained back 3, so that puts me at a 96-pound weight loss in the last, like, I guess 2 years, year and a half-ish. I don't really know exactly when to start counting. But, yeah, that's, I guess, I guess the most common question is, like, how did I lose weight? I didn't have weight loss surgery. I didn't take any diet pills. What I did at the beginning was MyFitnessPal on my iPhone, and that's like a calorie counting program, and it gradually decreases your calories as you lose more weight, and that was a huge help. And then I was also running a lot, and now that I can't run, I up until about 5 months ago I was still using the MyFitnessPal, but I think, to be honest with you, until about, I don't know, 6 or 7 months ago, I was still like really healthily eating and keeping the weight off that way. And I still eat healthy. I am a vegetarian. I do on occasion eat fish. It's probably, I don't know, maybe a once a month thing. The majority of my diet is all vegetarian. And I don't eat much dairy. That's very rare. I'm not a vegan, but I just don't really care for how dairy makes me feel. I'm not lactose intolerant at all. It's just, I don't know, it just doesn't agree with my digestive system, especially since my gallbladder came out. And especially since my gallbladder came out, I can't eat a lot of sweets, so that kind of helps with my diet. But honestly, being sick has helped me lose a lot of weight. And I don't recommend getting sick to lose weight, but the infection that I had after my gallbladder surgery, which was January 22nd, is called C. diff, which is short for Clostridium difficile. It's a type of colitis, and basically what that does is, well, I'll tell you how it's acquired. It's a spore, and it's acquired either through overexposure to antibiotics or through ingesting shit. The spore is basically acquired in crap, and you can either become exposed to it at a hospital or nursing home, and it's transmitted. I read an article online that said if you swab any hospital or any surface in a hospital, it will come up positive for this spore, and you ingest it, which is kind of gross, and the normal flora in your intestines will keep this at bay. And some people are natural carriers, that's rare, but like I'm not really sure, whatever. But like, all you do when you have this infection is crap, like constantly. You will literally shit yourself, well, not shit yourself, but shit like 15-20 times a day, and it's just like diarrhea, and it's water, and it's awful, and you have stomach cramps, and you have no appetite, and it's not, I mean, it's worse than food poisoning to me, in my opinion, and it's like the worst stomach pain ever. And I probably was, the first time I had it, it wasn't so bad, and I took Flagyl, and my doctor kind of messed up because she didn't, when she discharged me from the hospital, I was taking Flagyl. When she discharged me from the hospital, she didn't call in a prescription, and so 5 days went by and I had no meds, and I was calling her, and it was a mess. So, I went 5 days, and this bacteria, I guess, had a chance to just evolve in my system and become resistant. And then I took, the Flagyl, the remaining course, finally, and it came back. So then they had to give me vancomycin. Oh my God, the second time it came back, it was the worst thing ever. I probably was eating like maybe 300 or 400 calories a day because I couldn't eat. I had no appetite, and every time I ate, like, you could actually see my stomach just contracting. It was awful. And I'm not exaggerating, like, when I say I probably felt like a woman in labor. I mean, the stomach cramps were so severe, and I was sitting at work, and you could just watch my stomach contract, and I would double over in pain, and it was awful. And the first time I went and took the test for the stupid C. diff, it came back negative, and they were like, oh, there's nothing wrong with you, it's just stomach ache. And I'm like, well, people with stomach aches, they don't crap. 20 times a day. And in my job, this is TMI. I don't even care anymore. But like in my job, I sit in this little closet, and somebody has to give me a break every time I want to go to the bathroom. And it would be like, excuse me, can somebody come sit here? And I'd go, oh wait, I have to go again. Can somebody come? And it was ridiculous. So finally, you know, I went again, and then they lost the lab results, and then I went again, and then I was like, nobody called me, and I'm like, look, what is going on? Oh, you have C. diff. Did nobody call you? Yeah, it was bad. So then they gave me some Vanco, and then it went away, and then, I don't know, like 2 weeks after I stopped taking the Vanco, it came back, and then my insurance wouldn't approve the drug that I needed because, yeah, and then they told me, oh, you're negative, but you're symptomatic. I don't know. So then I had to go see an infectious disease doctor, and I'm taking Vanco at an extremely high dose again, so it's not fun. So I mean, that's honestly how I've kind of lost more weight. But I think now, hopefully, like, I'm hoping that I can start exercising and being a normal person again. So I think the first like 70 pounds, 75 pounds came off in a normal, healthy way, and the last, you know, bit of it came off unhealthily, to be honest. But like, so my recommendation for losing weight is to exercise and jog if you can, and like just start off slow. The Couch to 5K app is awesome. Like, it starts off so slow, and for somebody like me, when I played softball, like I played for 10 years, I could hardly even run around the stupid, like I couldn't even run the mile in PE class, like without, I couldn't do it. And by the end of the Couch to 5K, you know, I was running just about the 5K. I never did finish that 5K because that's when this whole thing started, but like I was just about there, and it was shocking. And people that knew me my whole life were like, really, Natalie, you're running? So I mean, I highly recommend the Couch to 5K program, and I highly recommend MyFitnessPal. And if you do those things in conjunction and do it the right way, like not just cutting the calories, but paying attention to what you're eating, like the fat, because it tells you, you know, every day it tells you what the MyFitnessPal, it tells you what you're eating and what you're eating too much of and what you're not getting enough of. If you really pay attention to that, you're going to lose weight. And I mean, it really worked. It really worked a lot for me, and you'll be shocked at the amount of calories you're eating, and then your stomach shrinks and you don't feel hungry. I mean, it takes a while, but you don't feel hungry, and it becomes hard to actually get enough calories. And the more you exercise, the more calories you get, and you feel good, and you don't want to eat because, I mean, you don't want to eat too much because you don't want to put on weight. So it's like, yeah. So now I'm getting off on this tangent, but I don't know. So in conclusion, I am looking forward to feeling better and continuing to lose weight. I don't really want to lose much more weight. I just kind of want to tone up what I got, and eventually I am, this isn't a long while, it's not coming up anytime soon, but I am going to get a tummy tuck, because after losing 96 pounds, this area in my stomach and here in my arms is not so pretty. I mean, I'm happy with myself, but it's a little loose, and I would like to be comfortable wearing clothes that are cute. And I often wear like little dresses and stuff, and I don't really care sometimes, but then other times, you know, I'll be like, bye, and then I'm like, oh wait, you know, bye, you know, I don't know. But yeah, and you know, you only got one life, and you should be happy. You should be happy in that life. So I don't even know what I'm talking about anymore. But also, something that makes me happy and helps me lose weight is my dog, Liv. Hey, come here, come here. She's very motivational, and she's like, come here, come here. She's sleeping, and I woke her up. She likes to go on walks, and she's a good girl, and she's very sweet. And actually, she is going to be trained as a medical service dog, because when and if I faint ever again, she is trained, and she actually trained herself to alert me to that. So she's a very beautiful girl, and I got her at the pound, and I love her very much. Can you shake? Yeah. Can you say hi? Yeah, she's a very good girl, except for that she likes to eat my bras. So anyway, if you made it through this entire long, rambling, huge video, then I'm very thankful to you, and I hope to eventually get back to posting. I don't know, I was never regular with posting, but like I hope to eventually kind of find a schedule, and yeah, I don't know. Maybe. Really, do you guys want to see this? Look at this. Really? Yeah. Yeah. Maybe I can take you with me when I go to have my pacer put in. I'm not really sure how that will work. I'm not sure if I'll be up to it, but that'd be kind of cool. But I don't know. Let me know if you are even interested in seeing those kind of videos. Yeah, I think it would be kind of interesting. I like to watch those kind of YouTube videos. Before I had my EP study, I thought maybe I would have an ablation, and I was watching those kind of videos because it's kind of cool to be informed, but I'm going to shut up now. So thank you for watching, and I will hopefully talk to you guys soon. Bye.